Welcome to the DocTalks Podcast. I'm your host, Mandi Fields. I'm here to ask medical experts the questions you might have about diseases and conditions, from heart health to dementia and everything in between. Join me for a conversation where we get right to the points you need to know to navigate Canadian medicine and hospital healthcare. Hi, I'm Mandi Fields, and welcome to the DocTalks Podcast, brought to you by St. Joseph's Healthcare, London. On today's episode, I'm joined by Dr. Jeffrey Campbell, a urologist at St. Joseph's Hospital, to talk about low testosterone, what causes it, the symptoms, and how to manage it. Dr. Campbell is an assistant professor at Western University and a well-respected researcher into the latest treatments for sexual dysfunctions. Welcome, Dr. Campbell.
Thanks a lot for having me. Excited to be here today.
So my first question is, why urology?
Oh, that's a good question. Urology, truthfully, I love urology as a specialty for multiple reasons, which have probably changed over the course of my career. At this point in time, it's really helping patients with a lot of quality of life related issues that are very personal to each individual patient. So I really enjoy that every patient is somewhat unique, and I don't really follow much of a textbook or algorithm with a lot of my patients. And so I really enjoy that part. There's a lot of cool new technologies, and usually we're on the surgical forefront with a lot of things that we do. So that's always kind of fun and innovative. But overall, it's really kind of the people that I get to work with and the problems I get to help patients with.
Wow, beautiful. You look like you're a young guy. Like, are you a young guy? Are you from London, Ontario? Is this your stomping ground?
I'm not from London, Ontario. I've been here now for over a decade, so I consider myself like a Londoner, kind of. I like to think that I look young or feel young, but when I wake up in the morning after playing with my children, I feel not young. So I'm still trying to ride out the young years.
Well, you're doing it well.
Thank you.
So low testosterone sounds like it's quite self-explanatory, but can you expand a little bit on what it is and what are the different types?
Sure. Low testosterone, yes, as you imagine. So testosterone is the hormone that is commonly found in men to make men men. It causes a lot of the growth and development during puberty. It's responsible for a lot of sexual desire. It's responsible for brain maturation, other functional organs. Women also have testosterone. And so this is a very common circulating hormone. Low testosterone is obviously when that number is low. So over time, for various reasons, men can get a decrease in their circulating testosterone levels. So we would call it testosterone deficiency, or technically hypogonadism, which all basically mean the same thing. Testosterone, is responsible for a lot of things like energy level, muscle building, physical stamina, cognitive function, energy levels. So that is obviously important for many people. And as levels get lower, then it can obviously affect overall functionality.
And then what symptoms may people experience if they have low testosterone?
The most common symptoms people usually associate with low testosterone as patients really is the sexual symptoms. So one of the most common symptoms that people will experience is really a low libido or low sex drive. So patients will often lose interest in sexual activity altogether. Sometimes it can result in things like erectile dysfunction, sometimes can affect fertility or ejaculation or orgasm. But the other symptoms that are outside of the sexual atmosphere really are actually the cognitive and physical symptoms. So it, as I said, really is responsible for things like energy levels. So patients can find a lot of fatigue, difficulty sleeping, difficulty concentrating, sometimes mood changes or irritability. And then physically, they can feel similar symptoms to what we associate with menopause. So men can actually get hot flashes. They can feel low energy. They can get sometimes actually breast growth or tissue there, and even sometimes shrinkage of their testicles over time.
Is there a reason why it goes up and down like that? Or if it goes down, will it stay low until someone like you intervenes?
So that's a loaded question. Typically over time, men's level of testosterone will decline. So it is very normal for testosterone levels to decline as part of the natural aging process. But there are lots of things, which I'm sure we will talk about, that can obviously improve your testosterone levels. Testosterone also fluctuates during the day. So testosterone has this interesting rhythm where when you wake up in the morning, that's usually the highest level of testosterone during the day, first thing in the morning, and then it slowly will decline over time in the rest of the day. And then has another peak kind of late in the afternoon, around somewhere between 5 p.m. around supper time, where it will peak again and then slowly drop off. So it has two peaks during the day. And then so it actually has an up and down rhythm throughout each day.
Okay, so how common is low testosterone?
So again, varies totally with age. The older you are, the more likely you are to have low testosterone or symptoms of low testosterone. There's been some studies looking at men in the 40 to 60 year range, and they estimate around 25% of men, if you check them all, would have low testosterone values. The real problem is most men never get checked for their testosterone levels, so we don't have a comparison. So if you took every man in his 50s and checked his testosterone, you would have a humongous variation in terms of what that level is as a one reading is. But if you took that value as, say, 20, which is, we'll say that's arbitrary, you don't know if that man 10 years ago used to have a level of 30 or if he used to have a level of 21. So people feel very different even though they have the same level of testosterone because of what they may or may not be used to.
What would the normal level be?
So we can look at both free or total testosterone levels, which is a blood test that is typically done. It's usually done first thing in the morning because, as I said, that's when you have your peak. So if it's low when you have your peak, then we know it's going to be low the rest of the day. Depending on what lab you get, you're probably looking for a value between 7 and 25 or maybe closer to 10 and 25. That would be kind of the typical range for most people.
So when somebody presents and they find their way to you, if I was male and then I was complaining about a low libido, then I would be referred to. Would that be the next step from my GP over to you? Like what does that process look like?
Yeah, so most family doctors, I think, if you were presenting with low libido, low energy, muscle loss, etc., one of the first things that they're going to do is going to be check for a testosterone level. And I think they would do that before you could go on to see a specialist, which would either be me or an endocrinologist, which deals specifically with hormones. And so, yeah, that test would be done usually by your family doctor. Easy test to do. There's no cost associated with it, at least in Ontario. So it's something that, men can easily ask for and get done.
And then I'm kind of thinking of a situation in terms of the man's self-esteem. In my head, self-esteem is lower if there is low testosterone, if there's an inability to have an erection. Do you see that a lot? And how do you break those barriers down so people can talk about it?
Yeah, so dealing with anything related to sexual health, what men describe as their manhood or manliness and how they identify as kind of their role really in society is often very difficult. I mean, part of it is the stigma of what is associated with being manly, which testosterone does not. I always tell patients that's not what makes you manly, it's how you are as a person. And it is often difficult for them to present. I'd say there's kind of two extremes of patients when it comes to low testosterone. Some patients that are convinced their testosterone is not high enough and they just want treatment because they think it's going to make them feel better, even though there's probably other things going on. And people that never ask and never know and are almost surprised when you tell them their levels are very low when they're presenting with very common symptoms. When I see patients, again, usually they've had blood work done by the time they've seen me, but I also have a lot of long-term patients that maybe are referred to see me for their erections, and then we're kind of backtracking, looking at their hormones, or I'm seeing them for urinary symptoms. And again, this kind of comes up in conversation. I try to make it as comfortable as possible, and because it's so common, all men will slowly have issues with their testosterone or with their erections. So for me, it seems very such a common topic that I don't necessarily feel uncomfortable talking about it. And so I create an open environment for my patients. Like I told you earlier, I have a very kind of jovial relationship with many of my patients. We have a men's health clinic with, we make it more lighthearted rather than a serious medical clinic, which I think works in favor of a lot of guys feeling more comfortable. I've had many people say, I was really nervous coming in here. Thank you for making me feel not uncomfortable about it. And that's because we don't approach it as this very serious thing. It's something we can definitely help you with, and knowing that there's a lot of tools and a lot of men suffering with it usually makes people a little bit more comfortable.
Well, that brings me to the next question. How common is it?
So having low testosterone, the numbers really vary based on age. So as you get older, the number of people with low testosterone is obviously going to increase because that's the natural process. If you look at men in the kind of younger middle-aged adults between the age of 40 and 60, about 25% of people are going to have difficulty with low testosterone.
25%. Wow.
Roughly.
Okay. Is there a stigma attached to it? Were people seeking treatment for low testosterone? From your experience, or because you're on the inside of the walls? Like, are you aware of a stigma?
Very aware of the stigma. So again, there's two reasons people are stigmatized for it. One is guys associate being on testosterone as like the guys who are like at the gym wanting to like really bulk up. And so they think asking about testosterone implies that they want to like abuse it, because there is like an abuse culture out there for some patients. So I think some people don't want to actually to go on it because they think it's like this, kind of black box topic. And then there's other people that don't want to talk about it, like we said, because they feel less of a man, or they're not fulfilling their duties if they're having issues with their testosterone levels.
And then when I get to is it a clinic? If I go, your men's clinic?
Yeah. So I see a lot of patients through obviously St. Joe's, but I actually recently opened a men's health clinic where we see men for kind of more intimate issues, a lot of medical things like low testosterone, erectile dysfunction, other sexual health issues, recovery from cancer treatments, incontinence. And so kind of things that are a bit more sensitive. And that way I can spend a little bit more time talking to patients there, as opposed to kind of the hustle and bustle that we often experience in the hospital system.
You strike me as someone, you like to talk to people, don't you?
Yeah. I don't like to hear myself talk, but I really enjoy the conversation with patients and trying to find something that will work with them. So I think that's what's kind of unique about this area of medicine and this area of urology, is that, again, there's no one size fits all approach, is that everybody's goals are different. Everybody's tolerance for different treatments are different. Everyone's life are different. And so finding what really works for them is really satisfying.
I would think it would take a special touch because it's such a vulnerable part of the body and it's intimate. And so to be able to share that with a health professional, if you're seeking help, it really would take a special person to be able to make someone feel comfortable.
Well, I like to think I'm a special person. At least I'm told I'm special. But yeah, it's definitely a very intimate topic for people. But again, honestly, there's not much you can say at this point in time that surprises me anymore as a patient. Very open and happy to listen to patients about all of their various concerns, as big or small as they may be. And yes, it's not something you can bring up to a lot of providers, which is why we try to create a safe space for patients.
Can we talk a little bit about treatment? So what treatment is available and how successful is the treatment?
So when I'm talking to patients about treatment for testosterone, I approach it two ways. Of course, there is medical treatment, right? So there's lots of medication you can give. But what I actually try to approach is a bit more holistic way to try to actually improve testosterone naturally. So there is always something you can modify in somebody's lifestyle to actually naturally improve their testosterone before they are relying on medication. And I find that's always the best approach to start. If there's something modifiable, let's see what we can do to make it better. And I realize many of the changes that I suggest are often things that they've heard from their primary care physician or from other doctors, cardiologists, their partners. But for some reason, talking to their erection specialist usually really hits the point home, and we can make a few more changes. So things that I always talk about to naturally improve things. Number one is exercise. So physical exercise has actually been shown to improve testosterone as well as sexual function in male patients. So 20 minutes of exercise at a moderate intensity, which is 70% of your maximum heart rate. So heart rate usually around 110, 120 for most of my patients, 5 days a week. So that's not that much time to get your heart rate up and actually get things moving. Weight loss also hugely important. So if men have large amount of adipose tissue or fat cells, those fat cells actually convert testosterone into estrogen. So the fat actually carries an enzyme to turn that into estrogen, which eliminates their circulating testosterone levels. So weight loss and reducing that fatty area will actually naturally improve the amount of circulating testosterone in men. Diet, also hugely important. High protein diet, very important to helping with testosterone. It helps build the proteins that circulate testosterone. There are some supplements that people can use, which there's minimal evidence for it, but there's definitely not much downfall in it. So I often will suggest things like magnesium, vitamin D. There are some off-label herbal products, which I don't necessarily recommend, but they don't carry much harm. And then the standard things of making sure you are sleeping well, you're coping with or managing your stress or anxiety well, and you are not smoking or drinking alcohol. So all of those things actually have been shown to reduce your testosterone levels. And if you are smoking and drinking and not exercising, I can give you as much medication in the world, but it's not going to necessarily help your symptoms either. That's usually how I approach things at first, which, nobody wants to hear their doctor talk about how they should lose weight and quit smoking, but it is honestly the best thing you can possibly do for your sexual health and your hormonal health. And then medication, it comes down to lifestyle, how people want to get medication. So obviously you can supplement testosterone. It can be done either with oral formulations where they take a pill every day. They can rub on some cream or gel on their arm or wear a patch where they put that on every day. They can do injections, which we usually teach patients how to do. And that can happen once or twice a week or once every 1, 2, or 3 weeks, kind of depending on your dosing. And there's some nasal testosterone. So you actually inhale it 2 to 3 times a day through your nose. So you actually get those boosts, like I talked about earlier, to get that couple peaks during the day. And then it slowly decreases over time. They all have their own pros and cons. And it really depends on what fits everybody's individual lifestyle.
But you start with healthy diet.
Literally everything I see patients for, I always start with those things because I'm a millennial. I don't want pills to solve problems. So I try to, give my patients the tools that they can also improve some of these things. Most of what I see patients for can be improved with lifestyle changes. If they're resistant to lifestyle changes or they've made some efforts but not quite where they need to be, then for sure there's lots of medication you can consider.
Okay, thank you. Is there any new emerging research on the horizon into low testosterone that you'd like to share?
So, there's some new things that are coming down the pipeline or used mostly in the United States right now. There are different oral formulations. So the previous oral version of testosterone, which obviously would be most people's favorite, is taking a pill, not having to have needles. The problem was it gets metabolized in the liver. So it's causing problems with people's liver. So it's not commonly used anymore. But there are new ones now that are safe for people and do not affect the liver. There are very small implants also, which are now commonly done, again, in the United States, where it is a slow release of testosterone. So it's like a little pellet that gets inserted under the skin, and then that will slowly release testosterone. I believe there's 1 or 2 clinics that in Canada that are now starting to do it. It's more kind of a private pay. Patients will have to pay for it, but it is a kind of a slow release, super easy to insert. And then I believe it's a 3-month timeline where it kind of will slowly reduce its effect over time. So those are probably the 2 new things that are going to be available for patients. It's a constant battle with back orders and what testosterone is available in Canada, but hopefully those will help, especially if you can get long-acting versions. That will make things much easier for patients.
Oh, that's great. Thank you. I wonder about the stigma piece of it, that we could close out. If you're listening and you are experiencing low testosterone, or you're the partner and your partners experience low testosterone, what are some things that we could say to our partners to assure them that there's help out there and that it's okay?
Yeah, I think one of the most important things for patients, men, women, everyone, is to have a support person that you can talk to and be open with. For a lot of people, that's their partner. If you don't have a partner, it's a friend or a family member. Some people, it's a therapist or a counselor. So having that person that you can talk to, being open with people about some of the symptoms that you may be experiencing, or if you've heard of people who have had similar symptoms, suggesting that they be seen by their family doctor or go to a walk-in clinic, get tested for some routine blood work. A lot of the symptoms of low testosterone actually are symptoms of many other things. So it could be, related to thyroid problems, blood level counts, other hormonal abnormalities. And so it's important to just get checked. Everybody assumes it's normal to feel tired and it's normal to lose your sexual desire as you get older, and it's normal to gain weight or lose muscle mass, but it's not always normal. And we don't have to accept that this is just how things are going to be. So it's important to be an advocate for yourself to say, this maybe is normal, but I want to make sure that there's nothing else that's going on that could be causing this, that could be reversible. I think if you are a partner of a male who you may see experiencing some of these, which is really what you would probably experience or see, is like the fatigue, napping during the day, feeling really tired, the abdominal weight gain without necessarily changing their dietary habits, bring it up to them. Say, okay, I'm just wondering, you've noticed you've been feeling tired. Do you think anything's going on? Maybe we should get you checked out for some blood work. Telling your partner, you don't really seem interested in sex anymore. I think there's something wrong with you. Probably it's not the best way to go about it, but coming out of a place of curiosity and understanding is probably going to be very supportive. I think it's important for men who've had their testosterone checked or are having issues with testosterone deficiency to also talk about it. Usually these conversations occur at the gym, in the change room, at work, around the table, where you're kind of just sitting around, kind of killing time. And I've seen many people who've come to get tested because somebody else had similar symptoms and they realized that they actually had low testosterone. So it is totally normal for your testosterone levels to decline with age, but it does not mean that you have to suffer with the symptoms of it. And in fact, there's actually good evidence to support that treating low testosterone is actually protective for your cardiac health, so your heart health, and your bone health, and your mental health. And so if you are suffering from very low levels of testosterone, it's actually, in many patients, is beneficial to treat it for that reason alone.
Wow. Okay. I didn't know that. A lot of things I learned today.
Good. Well, that's the point. I guess the other thing is there is a question about patients who've had prostate cancer in the past, where whether or not it's safe to be using testosterone. And so I think that's an important change over the last couple of years, that it's been very much debunked that it is risky to use testosterone in the setting of prostate cancer. So it's been shown now in multiple trials, including a huge landmark trial that was published 2 years ago, showing that it is safe to use testosterone after treatment for prostate cancer, and even in patients who have low risk prostate cancer, who are under surveillance or undergoing treatment for that, which I think is a previous misconception where people felt that testosterone caused prostate cancer, which is very not true. And in fact, it actually can improve the quality of life of patients who have suffered with prostate cancer and are dealing with the consequences of that. So important, if you're having these symptoms and you've had prostate cancer, does not mean you should not get checked. In fact, it's something you should very importantly talk to your oncologist about, at least checking. And then those patients, you would come to see me and we would talk about that further.
Thank you very much. And thank you for joining us today, Dr. Campbell.
Thanks so much for having me.
That's it for this episode of the DocTalks Podcast. Thanks for listening, and join us next time when we'll continue our conversation on what's new and relevant in the world of Canadian medicine and hospital healthcare. Be sure to subscribe and follow us on Facebook and Twitter at St. Joseph's London, or visit sjhc.london.on.ca/podcast. Until then, stay healthy.